I'm so happy to be joined by Elsie Hewitt. She is an endo warrior. Her and I were fortunate to meet at the Blossom Ball this year. Um, you are like a ray of light. I met you. You're so warm. You're so welcoming and open. Like you want to tell people about your endometriosis so that you can help others that might not have a platform, that might be suffering in silence. And I appreciate that about you because it takes a lot of bravery to come forward with any kind of medical condition, but especially one when we're talking about our menstrual cycles in a society that's not always so welcoming to those that have these issues. So thanks again for being here.
Of course. Thank you for having me.
And I do want to congratulate you because you are pregnant. Your first child with your partner, Pete Davidson.
Yeah, thank you so much. No, I'm very excited.
So tell us about when you began to not feel well, when you knew something was wrong with your body.
I feel like, and this is something I hear so commonly just throughout different people's endo journeys, like the moment that I started feeling symptoms was so far before getting any type of answer, and it just got like progressively worse. I would say I always had bad periods, but I was kind of just taught to power through them or think that they were normal. And I think that there were a handful of times throughout like my teenage years and my early 20s where I knew something was like really wrong, but I didn't have any of the tools or the information or the education or the like support system around me to like investigate that. And I didn't have, unfortunately, the money to even see the type of specialist that I needed to see. And I don't think it was bad enough to a point where I was like, okay, this isn't like ruining my life yet, so I guess I'll just tough it out. Like it's really just, that's part of why this disease is so crazy. It's like you almost can't really do anything about it until it's so absolutely debilitating, at least in my experience and people I've spoken to. So yeah, I had a lot of pain and a lot of symptoms. And then last year is when things just started to get like completely unbearable. And I knew, I was like, I've exhausted every other option. I've taken every holistic approach. I just knew I like couldn't live like that anymore. And so that's when I opted to explore the surgery route, which obviously, you know, everybody has a different way that they go about their treatment and everything. But yeah, there was a long chunk of time in between symptoms and discovering what was going on with me.
So what age did you start experiencing these symptoms that you knew were not normal, but you were just like, but I'm able to push through?
Mm-hmm.
How old did you say you were?
Well, you know what's weird is still to this day, I don't actually know when it started getting so bad because, and I've said this before, I think we're programmed to forget pain or just like downplay pain. And then when it comes to specifically women and menstrual cycles and reproductive health, it's this thing that we just don't speak about enough, and we just sort of power through. And so I still don't know if what I was feeling throughout all of my teenage years was normal, like just really bad period cramps, and then it developed into something bad, or if I've just had excruciating pain ever since I had a period. But I do remember when I was living in LA during my early 20s, my periods were like really, really debilitating, but it was only for a couple days maximum out of the month. And so I just
Sure.
knew, okay, this is what I need to do when my period comes. I just get really, really bad periods, and then we move along. So that started around like my late teenage years, got worse into my early 20s. And then
Yeah.
mid 20s, it just got progressively worse throughout my 20s. And then last year, it hit a point where it was like I was wiped out for like a week at a time. And then spent the next week trying to like recover from what my body had just gone through, you know?
Well, I also think with endometriosis, we know a few things. We know that pain with our periods is not normal, despite societal conditioning that it is,
Is
and
it
that
really
women are.
is it really not? Sorry to interrupt. I just like still don't know because I've been told by doctors like or somebody told me like yeah, if you're experiencing pain that is like debilitating and causing you to not be able to function, something is wrong. But to
Yes,
me, I was like, no, like still even now, I'm like, was that my endo the whole time?
probably. I mean, I'm not a medical professional, but you know, they say like if you take an ibuprofen or Tylenol or whatever and use a heating pad and your period pain is not alleviated by that, and it is, to the point where it's disrupting your day, you're not feeling well, you have an incredibly heavy period, you have nausea, you have bowel issues when either, a week before or during your period. Um, all of those things are like key indicators that you could have endometriosis. And, it goes back to like thinking that periods are not comfortable. Like, I don't know anybody who's like, oh, yeah, I'm on my period. It feels great.
Right.
To me, like one person who feels that way. But we do know that those with endometriosis do present differently. Everybody has different symptoms, but commonly, if you're in that kind of pain where you don't want to participate in your life because you're like, oh my God, I'm stomach sick, I'm nauseous, I have a low grade temperature. There's so many different ways. That's not normal. We also know that endometriosis can, for many women, progress and get worse over time. So it makes sense that you started really having uncomfortable periods. And then after a number of years, it got to a boiling point where you were like, I can't function anymore.
Right.
I mean, this all resonates.
Yeah.
It's like, makes complete sense that
Yeah. And
you,
it's kind of sad that like it does sort of have to get to that point for me to feel like I'm even taken seriously or even like taking myself seriously. Like taking my pain seriously, even though I knew in my gut that something was wrong and had been wrong for a really long time. And I've always known I wanted kids one day. I always knew I wanted to start a family. And so there was always this voice in the back of my mind that was like, there's something wrong and this could be really affecting your fertility and your future and all of that. And there's so much unknown. It's like so scary.
did you come to the conclusion based on things you were like seeing or reading online or socials that you were like, I could have endo? Like, when were you thinking I could have a disease? So therefore, I'm going to go see my doctor and figure this out?
It's a good question. I don't I don't really know because I mean I was misdiagnosed a handful of times. So I would, and it was a weird one too because I had a doctor in LA who didn't specialize in any of this stuff. It was like a regular OBGYN. And
Uh,
so she told me like it's very, very likely that you have endometriosis. But it was kind of the thing where I would come in, I would be in a ton of pain, and I would say, I think my symptoms match this thing, or I think I have PCOS, or I think I have endometriosis. And then it was this thing of like, yeah, probably. But
Plan.
there was no thing in place of like, let me send you to this specialist, or this is what you need to do. And it was concerning to me that there was such a lack of knowledge from someone who works so closely in this, like in these spaces.
Yep.
But I was aware of what it was, but then I think too, like I downplayed it, and I think in my mind I was just like, well, I probably don't have that. I'm probably just overreacting. But I think that the only way I was really able to come to a conclusion with my own diagnosis is doing all of this research myself, and then finding the right specialists from there who would validate what I was going through and then treat me properly. And yeah, that took a really long time. And I think also because it's so hard to get a diagnosis, I felt wrong saying that I thought that I had it until I actually like got the surgery.
Yeah.
Like, cause otherwise it's just suspected, or it's like, yeah, you probably have it, but there's not really anything you can do until you get the surgery. I think that's part of why this disease is so complex and layered and difficult and scary and painful, is because, oh my gosh, I mean, I haven't experienced symptoms in a while because I've been pregnant and I got the surgery. So I haven't had a period the last few months. So it's been honestly really nice that I just haven't had to deal with any of that for the first time in so long.
Yeah. It's yeah. It when people ask me, because when I was pregnant and I was infertile and diagnosed with endo at the same time, and it was like the same thing for so long. I got my first period at 11, always had terrible periods, thought it was totally normal, ignored it, had ovarian cyst ruptures, told go on birth control, like the whole thing. No one mentioned endo to me or to my mom. And same thing. I was like on the struggle bus every single month with it. And it wasn't until I was 32, long time, that then, endo was the cause of my infertility. And I, like you, wanted to be a mom. And I went through a lot to get pregnant. But then when I was pregnant, I was like, oh, this is nice. Like, it was such a break from endometriosis, because I'm like, I didn't know anything else for so many years.
Right.
So can I just, like, Elsie, we don't know each other very well, but I feel as though you're still struggling with your diagnosis, and that's really hard. Like, I interviewed Leslie Mosier last week, and she said something that made me cry. And I struggle with it, having endo. And she said that for a long time, she wouldn't allow her endometriosis to have a seat at the table. Like, she almost like shunned her diagnosis. And she said it took her a long time to be like, I'm Leslie with endo, and Leslie with endo can have a seat at the table too. I think when we think of ourselves, we don't want to think of ourselves with like a chronic illness. It's really hard. And I've been diagnosed since 2016. It's 2025. And I still don't like feeling like I have something wrong with me.
Right.
And I talk about it all the time. And I still get nervous telling new friends about it. I get nervous, sharing it with a partner. Like, it's something that makes me feel vulnerable. And I think I'm pretty tough. And I hear it in you too.
I think I can recognize that in myself, because I think I take a lot of pride in the fact that I am a strong person physically and mentally. And it's almost like when I say the words, I have endometriosis, it almost feels internally like I do feel this little inner like fight happening where I feel like I'm saying that there is something wrong with me, or that there is, well, because there is, but then it feels like it equates in my mind to like I am disabled, or there is like I'm not capable, or I'm suffering, or I'm a victim. And it feels negative. And I never want to victimize myself, because I also consider myself really lucky that I, was able to find the resources to get the help that I needed. And there was I did that all on my own.
Mm-hmm.
But it doesn't mean that I'm not allowed to sit here and say that it totally sucked and that, like, it was one of the hardest things I've ever gone through in my life. But maybe I do struggle with my diagnosis because it makes me feel like I'm sounding like there's something really wrong with me.
There's not. You're perfect. There's nothing wrong with you. And I think so many people feel that, and thank you for sharing it, because I know there are people watching right now who are like, that's me too. That's me too. I mean, I got to the point where I had one friend when I got diagnosed with endo and I went for my first surgery. She was like, well, that should be it. That's your fix. Like, you're good now. And then I was still having symptoms like a year later, and I needed a surgery like 2 years later.
Really? How many have you just had to? Just had to. How many have you had?
No, I don't want to. I don't want to scare you.
Oh my gosh.
I don't want to scare you.
What is it? I feel like I need to know.
Oh man, I've had multiple endo surgeries, excision surgeries, and I have, again, not everyone's endo is the same. Not everybody has, extra pelvic endo. Not everybody has endo that doesn't quit. Some people have endo and, have an exploratory surgery, get a confirmation, and they're good with suppression therapy, or they're good after having, like having babies. Everybody's so different. For me, endo just would not quit. Like, I got endo after I did my IVF protocol for my son. I got endo really badly 7 months postpartum. So after my like beautiful pregnancy, I've no endo symptoms and feeling great. I got, a really bad, just really bad endo. And I almost went into kidney failure for mine. So that was terrifying. And then, later it came back, and I still haven't talked about some of the things. And I will. It's just not quite ready yet, because we're all at our like, are acknowledging our vulnerabilities and our struggles. But I've had multiple, and I don't ever want anyone to feel like that's their path, because I've just had a wicked time with it. But I've had to also embrace through my endo journey, like when you say like something's wrong with you, like, yes, clinically you have a medical condition. But the one thing I'll say about endo is that it's made me so aware of my strength physically, but also just like emotionally. It's helped me develop such a resistance in life and a grit that I did not have otherwise. And I see that in so many people with endo. I see that in you, because I think we're a feisty bunch. Yeah. I saw that at Blossom Ball, like in this room of powerful women, and people born with the uterus who, we're all just there showing up for each other. And I think sometimes we don't show up for ourselves. We show up for our fellow endo warriors. So, I just don't want you ever to think you're less than anything, because you have this disease, and you being here and showing yourself strong is symbolic of strength.
Thank you. I mean, I feel like it was such a no-brainer for me to have this be a thing that I share, because I hate the fact that people are actively going through what I've had to go through. And it's interesting because I do feel like I speak about it as if it's like in the past and behind me, but I am very much aware that it's very likely that it'll come back. And I know a lot of women do have multiple surgeries in their lifetime, and a lot of women have one, and it's what you said.
Yeah.
Everybody's journey is different. So I think I'm just right now, like, and I can't lie, like there is like this fear that creeps in, or this voice in my head that tells me that I'm being stupid by being this way. But I think I'm just being present in the fact that I don't have symptoms right now, and like embracing that for the first time in my life. I don't feel this excruciating pain, and I am scared for what might happen in the future, but I think I just have to trust that I've proven to myself that I can do it once, I can do it again. And you're right, there is this strength, because we have no choice but to figure it out and survive. I have a question for you.
Okay.
And totally all good if you don't feel comfortable answering it, but do you feel like your endo somehow in some way kind of prepared you for childbirth if you gave birth like naturally? Or just even the pain?
So I ended up having to have a C-section because my child was like huge.
Really?
He was 9 pounds.
Oh my gosh.
I'm not that big of a human being. So like I was very like I was just like, my doctors were like, she's just gonna be too big for you to deliver. So I did a C-section. But I feel like the entire, like, medically, having previous surgery in, abdominal area and all that, I feel like I was really aware of my body, and I was able to advocate for myself during like my pregnancy, and then even in the birthing situation, and then even the postpartum, because I think, everyone's so focused on the baby that they forget about the mom. Like, the baby comes out and it's all baby, but the care for the mother is so paramount. So yes, I think you're going to be really prepared and really strong, but not that you're asking me for unsolicited advice, but like, if something doesn't feel right after at all, I don't care if you like, you think you're overreacting, you're not. Always be like, I know my body and this doesn't feel right, or I feel dizzy, or can I get my iron levels checked? Can I get my blood levels checked? Like, just stay on top of your health, because it's so easy for everyone to get consumed with the baby. Childbirth is like, can be it's no easy feat, and there can be complications. So you have learned how to use your voice and advocate for your well-being. So I would just say, continue to do that. Like, take those tools with you.
Yeah, thank you. I definitely feel like one of the biggest takeaways from having this illness is really listening to my body and my gut and knowing when something is wrong. And I've been honoring that like throughout this new journey I'm on now. And I think you're totally right. I think like mentally and like spiritually, in a way, it's like you do feel a little bit more equipped to just like listen and be super in touch with yourself.
Yeah. No, you got this. You totally have it.
Thank you. I'm nervous. Like, I'll randomly be like hanging out, and then I'll remember like, oh, I have to give birth. Like, what?
Tell you helped me. This is what helped me. I am not like, I like my processed food, which I know, like, oh, horrible, whatever.
That's all
I know.
need
It's
then.
not. Okay.
Just kidding, but it's not
No,
right.
no. So I for like the first time in my life, I did mat Pilates, which really helps my core, which is so good, because you want to have lower back strength. You want to have like, pelvic core strength, abdominal strength. And then I ate really clean. Like, I ate just really, really clean for like the first time in my life. And I reverted back after. It's fine.
That's crazy, because I feel like that it's flipped. It's like, what about all the cravings?
All I wanted was cheese and pickles and tomato juice. I would just have virgin Bloody Marys that were like super, super hot all the time. What are you craving right now?
This sounds horrible, but like the other day I was like, what? I'm craving something that this sounds insane. I'm craving food that like isn't fresh. Like I'm craving like these Annie's pizza rolls. You know, Annie's, they have like mac and cheese and yeah, these
Yes.
pizza rolls that I discovered like last week, and I have just been eating a lot of those.
Organic brand.
Yeah, but there's still like you put them in the oven and like it's not great for you. But I'm like, I don't know what it is, but I've been craving like packaged frozen food. But that's a very like generalized thing because then I'll go like I went through a whole phase. I don't know. It's been weird. I'm like, I'll be so hungry and then nothing sounds good, or I'll just be ravenously hungry and I cannot stop eating. I feel like at the beginning I was really basic and I was like just having the most insane cravings for pickles. Pete got me like 30 jars of pickles. Like I told him one time, I was like, I feel really basic right now, but I'm really craving pickles, and I just ate one, and it was like a really great experience. And then he came over, and he had like 50 jars of like every single type of pickle. I was like, oh,
Really sweet. And I do believe it's because there's something that happens where like our bodies are craving the salt.
yeah,
Like there is like a physiological reason that happens. But good on Pete for being such a supportive
oh my gosh,
partner.
it's the best. It's like it's almost like you shouldn't be letting me eat all of this. I need to calm down. But I think you're right. I go through phases though where I'll just be like obsessed with something for like a week and then I move on to something new.
Yeah.
And I'm just a big foodie, so I've been letting it happen. And
let it happen. This is all about listening to your body. I mean, that's the whole thing, is that don't deny what your body wants. Like, you know, like within reason. I think that's kind of how we should always operate.
yeah, within reason.
Within reason, of course. But for people that are watching that have been in your place where they don't, you know, want to like relinquish to the pain, and they're like, I think there's something wrong with me, but maybe it's just me, maybe I'm the problem, like getting all into their heads. What advice do you have now that you're on the flip side? What advice do you have for those people to work through it?
I really do think I always come back to this same sentiment of just trusting your intuition if you feel like there's something wrong, because that's the thing that will guide you through no matter what. And in a field of so much misdirection and so much belittling and like disregarding of pain and sort of downplaying and being made to feel like it's nothing or we're overreacting, really, really listening to that gut feeling of like, no, I know that there's something wrong, and just like not giving up and continuing to really fight. It's like that same, but I think that's just, it just comes to people who have this disease, right? It's like that same strength and stamina that we have to show monthly when we're going through this pain, or in many cases throughout constantly, because for some people it progresses to a place where it's all the time. And like we were talking about before, you know, it manifests in everybody differently. But that strength that you have to show physically to survive, I think it carries through into the mental side of it. And it's such a mental battle. But like we all do possess that strength, and just like recognizing that and trusting that we can get through it. And like you will arrive at that place of validation and answers. Like I remember the moment my surgeon called me after, because I woke up from surgery thinking something was so wrong because I was in so much pain. And it was from, you know, because they fill you up with the gas and then you feel it in your shoulders, in the back of your, and you're like, something is wrong. I thought like that like a lung had been punctured or something. I was just like, this is bad. Something went wrong. And I was having like intrusive thoughts about my lung being like literally exploded in my body. But I called her and she was like, Elsie, you're fine, but we found it everywhere. And it's such a bittersweet feeling because you're like, my pain was real. My pain is real. This is so validating, but then it's like heartbreaking at the same time that this has been inside me for so long, and it took so long to get the answers that I need and the treatment that I needed, and that it takes going to such extreme lengths to find any kind of relief. Anyway, that was like a really long-winded answer that I don't even know if it really answers the question.
It totally makes sense. Yeah. The fact that it takes an average of like 7 to 12 years to even get a diagnosis, and in between misdiagnoses happen, and also the mental and emotional load that you carry along with that, questioning your own sanity. And then, like you said it so eloquently, bittersweet, because on one end, it's like, okay, I'm not crazy. I'm validated. I knew something was wrong. Now, 100%, I have the medical evidence that I knew something was wrong. And then on top of it, oh my God, something is wrong.
Right.
Now what?
Right.
Like, this isn't a cure. Now what? And that's where the patient advocacy gets really difficult, because we're only as good as the science. We're only as good as the medical interventions. And let's be real, there's not many.
Yeah.
So like, how much do we have to carry it? Because we can't carry it. And I'm really bad at sports analogies, so I'm not going to try too hard. But like, I don't think you or I have the ability to carry it to the finish line. We can only say like, I know something's wrong with me. I need help. I need a medical intervention. And then what? That's why like we're doing what we're doing by speaking up, because we need the voices in the back, or the people in the back, to hear our voices in the front saying our whole community needs some major help here.
Yeah, no, 100%. And it is this thing that is such a isolating experience, and that's why I'm so glad that I've been able to find community and like work with EndoFound and be a part of something bigger than myself. Because I mean, being at that gala and hearing these women's stories and seeing all these strong, powerful women that have all had such a unique and like singular experience, but talking about it as this like team, as this like group of people who all are in solidarity of each other, because we all know what it's like, we all have the same thing. But it is kind of fascinating, right? The way that it develops and manifests so differently, and it's such a case-by-case thing. And going back to the pregnancy, I think there's like this level of, because endo being linked to infertility and all of that, like there is this level of like empathy that all women with endo need to have for one another, that everybody's journey is so different. And it doesn't mean that one person's is more important than the other, but it's everybody's is different. But the fact that we can all like come together and support one another is so important in a world where we're constantly being told that we just have to power through it or whatever. It's like, no, this is real. Like that was really powerful for me being in that room.
Yeah. Yeah.
And then it also made me feel kind of bad for myself. I was like, oh, damn, like I really have been going through this for like a long time, because I still downplay it. I'm like, yeah, I have this thing, but like I'm fine now. I never want to sound weak.
You're not weak. You're not weak.
Thank you. But it was really it was a crazy reminder for me. And I honestly think it was so beautiful also to have my partner sitting there with me, because for him to see that, I think for both of us, it was just this amazing thing of like, oh, wow, like, I think I've been downplaying this. And he was like, oh, wow, like, this is intense. Yeah, I think that was like a very, like, important moment for me.
Yeah, because then you have somebody who can have great empathy for all that you've been through and is seeing like you through even another lens.
Yeah.
So, and I saw him that night. He was so gracious to everyone, and I could see him like talking to different endo advocates and patients and like intently listening to what they were saying because he wanted to learn, to be and I'm not speaking for him, but from what I was gathering, like this is my interpretation, that he was like so eager to learn because he wanted to be, as supportive to you as possible.
Yeah. It's really special. I feel that too.
Yeah. Well, this conversation has been really special and probably one of my most thought provoking in a while. And having the tables turned on me, Miss Elsie,
I
asking.
have to.
I like it. I like a good question. And, even personally, please, you can always, I've been in your shoes. And if there's any way, like ever, just reach out.
Thank you.
Because
Same.
yeah, for sure. But I'm just so happy we had this conversation and that you're feeling great and enjoying every moment of your pregnancy. And just come back anytime you want to talk. Anytime.
Thank you. I appreciate it. I look forward to doing more of this in the future.
Me too.